Anyway, okay, so we're gonna get into like some of the questions, the burning questions that you guys asked me. So I asked you guys on Twitter and on Instagram, so we might not be able to get through all of them, but we'll get through some of them. Okay, so the question is, if you are virgin, is it still required for you to have a smear test?
Yeah. Oh, I absolutely love this question because I feel like a lot of women don't know this. Yeah. So the short answer to that question is absolutely not. Okay. And the why are you not required? So the main cause, so why are you going for a smear test first and foremost? You're going for a smear test to check whether you've got changes to the cells within your cervix that could lead to cervical cancer. What causes cervical cancer? So in the majority of cases it's caused by the HPV, which is a virus which we get from men during sexual intercourse. So if you haven't had sexual intercourse with a man, if you have not had penetrative sexual intercourse with a man, then your likelihood of developing cervical cancer is minimal, almost nil. Therefore, you do not have to have a smear test if you are still a virgin.
Okay. That's a very straightforward answer. I think some people will say but the way you've explained it...
No, absolutely not. Absolutely not.
Okay, so you heard it here first. Somebody said, what is the ideal age to freeze eggs?
Woo! What a question. So, a woman's peak fertility, guys, peak fertility when you're most fertile ever is when you're about 24, 25.
That means I've passed it.
Me too, don't worry. Many years ago. So, if you wanted to think about that, then you'd say, I should freeze my eggs at 24, 25, that's when I have peak fertility.
And how many people can afford to do that at that stage?
And who is even... when I was 24, I was not thinking about my future fertility. I was still in medical school, actually, come to think about it. It wasn't on my radar, it wasn't on my agenda, but it's a question that a lot of women are obviously asking now as we are starting to start our families a little bit later, as to when that's best to do. If you really, really, really are considering it, though, I would recommend discussing it with a fertility, a gynecologist who specialises in fertility. If you are really concerned about it, if that's a big thing. But in terms of ideal time, it's difficult to say, but that's when your peak fertility is, guys.
Okay, that's great. Thank you very much for that. Somebody has asked, what is a remedy for period pains?
So, like I think I discussed earlier, so everyone's pain threshold will be different when it comes to periods, but I am a strong advocate of hot water bottle. I'm sorry, but that works. That is shown to reduce the inflammation.
And a hot shower sometimes.
And and a hot shower and a hot bath can work wonders on its own. I would start with that simple paracetamol and ibuprofen as well, which you should only really be taking if you don't have asthma or don't take it on an empty stomach.
I'm asthmatic, so I just recently learned that I'm not supposed to take ibuprofen.
You're not supposed to. It can trigger your asthma, so you just need to take paracetamol. And if you're needing things that are a bit stronger, see your GP. They can prescribe you things like mefenamic acid, which I spoke about earlier, which is like a stronger type of ibuprofen again, but if you're asthmatic, that wouldn't be for you. If you are fed up with your painful periods and you want to essentially stop having a period because they are so painful, then again, there are hormonal options. Not for everybody. I know a lot of women want to be as natural as possible, and I completely understand and respect that. But if you are thinking, I'm done, the pain's too much, you've got the combined pill, which can not only ease the flow of your period, but also help with period pain, and things like the coil and things like that.
Okay, thank you so much. That was a great answer. Somebody asked, I would love to know how weight issues can affect menstrual cycles, especially for plus-size women.
This is a really interesting question, and I get it a lot as well. Some of my patients who come to see me are overweight, they're struggling, they're trying to lose weight, but so they've gone to their GP and said, this is having period issues, my periods are really heavy, and the first thing that they might hear is, you need to lose some weight. And the reason that is because your periods are a hormonal thing, right? So if you are heavier, if you have more fat in your body, that means that you are creating more estrogen. So estrogen is what will drive your periods, that can make them heavier and can sometimes make them more painful. So I think as much as it sounds like we're just saying, well, fobbing you off, you just need to lose some weight. I think if you start by dropping, losing weight, we always say the ideal, if you can get to sort of a BMI of 30, that can actually make a difference as to how heavy your periods are without us even having to start hormonal therapy or anything like that.
Okay, that's great. Thank you so much. Okay, somebody asked vagina health. What are your top 3 vagina health tips?
Oh, well, yeah, you need to look after your vagina, guys. So my top one would be don't douche. So douching is when you use the shower head to essentially spray water into the vagina, thinking that you are cleaning it, and it makes us feel better as women. We feel super clean down there. But what that does is that it takes away the vaginal normal bugs, which maintain a normal pH, which is really important, pH balance in your vagina. So if you're over douching, you'll get overgrowth of other things, which aren't nice. Things like BD and things like that can be really smelly. So don't douche. Secondly, I am not really an advocate of using perfumed or scented washes to keep your vagina clean. Just sort of a normal sort of standard shower gel that doesn't have too much scent in it, and water is good. And also always wear cotton underwear.
Okay, great. Okay, great. Thank you. Someone asked how to spot potential concerns: endometriosis, Pcos, fibroids, and HPV. So, are there maybe some small indicators?
So we'll start with endometriosis. Okay. So, like I spoke about it a little bit before, but if you are having period pains that are starting a good few days before your period, lasting throughout, and not getting better with just simple paracetamol, if you're having pain on intercourse, and for example pain opening your bowels, that might indicate endometriosis, so you do need to get seen about that. Fibroids, if you feel as though your periods are much heavier than what you think is normal. I sometimes describe things called flooding, so that's when you're wearing a pad but your period completely misses the pad, it goes all the way down. If you're having those types of accidents where you're bleeding through clothing, which can be really distressing actually in most cases, especially if it happens when you're at work or when you're out, then that might indicate that, fibroids, you might need to get that checked. PCOS, so that's a big one actually.
Yeah, we didn't get to speak about that, so if you can give us a little bit of info about that.
So PCOS, or polycystic ovarian syndrome, is a collection of different signs and symptoms, and we group it together and call it a syndrome. So it is possible to have polycystic ovaries, i.e. cysts on your ovaries, without having the whole syndrome.
Okay.
The syndrome itself is characterised by increased facial hair. It can be quite difficult for you to keep your weight down, and also you'll either have really irregular periods or no periods at all. So it's very much a hormonal imbalance.
And acne sometimes.
And acne, exactly. Okay. And that's because the body's overproducing androgen, which is predominantly a male hormone. Okay. So essentially it stops you ovulating, but also gives you sort of those other symptoms as well. Okay. And again, really, 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 really common. Okay. If you are having irregular periods, guys, and you are not having a monthly period, then I would definitely see your doctor about potential investigations. It can also make it more difficult for you to conceive. Why? Because if you're not ovulating regularly, you're not going to get pregnant.
Okay, so basically somebody wanted to know what options does she have being diagnosed with a hormonal condition, as she feels like the pill is slapped on people carelessly given the side effects. So what advice would you give?
So it depends on the hormonal condition that she's being diagnosed with. So the main ones that I see as a gynecologist will be PCOS and endometriosis. So they are hormonal conditions. They're driven by female hormones. So in terms of endometriosis, it depends on the severity of the endometriosis as to sort of the treatment options available. We tend to offer what works the best for that person, and also what suits that person's lifestyle. In terms of endometriosis, the combined pill, well actually both of them actually, can be used for treatment of endometriosis, and those we tend to recommend those because it's a pill does have side effects, but most people actually feel as though the treatment the benefits that they get from the treatment outweigh the side effects.
Okay.
So we're happy to sort of persevere with that. Also endometriosis we do see in younger women who aren't even thinking about starting a family yet. So having a contraceptive on board as well is actually sort of, you know, killing two birds with one stone is quite helpful. We do recommend it because of the evidence. I do understand that some people think it's just, you know, just take the pill, it'll be fine. But there is a reasoning behind us recommending the pill.
Okay, and for
PCOS? So PCOS, the reason that we might recommend hormonal treatment there is because if you're not having a period at all, or if you're having irregular periods, what happens is that you still get the building up of the lining of the womb, but it doesn't shed. And if we think about it, if you keep on building up the lining of the womb and it's not shedding every month of the period, you're slightly increased risk of those cells that align the womb to mutate, and that can cause what we call endometrial cancer later on. So we try and reduce that risk as much as possible by giving you a hormone which stimulates the lining of the womb to shed at least a couple of times a year, so that we can slightly reduce that risk, and that's one reason why we might offer you hormonal treatment if you have PCOS.
Okay, thank you. A young lady asked, advice on what a patient who's a SV, I'm guessing that's sexual violence, or FGM survivor can say, do to ensure their gyno exam goes as smoothly as possible.
This is actually really, really important. I'm glad that she's asked this question, because especially where I work in Birmingham, there's a high population of women who have unfortunately suffered FGM or female genital mutilation. So in terms of us as doctors, so we have to be trained in how to communicate and examine women who have unfortunately undergone this type of trauma. If the patient or the woman herself is comfortable enough to talk to us about what has happened, then we are more than happy to listen and understand, because it can then help us when it comes to the examination in terms of what we can do to ensure maximum comfort for that patient. I think it's something that has to be done sensitively, to say the least. I would always offer to have a chaperone in the room, so that's also to give comfort to the patient, as well as to, you know, sort of protect myself in terms of making sure that I'm examining correctly. And I think we just have to be as empathetic as possible. Some gynecological examinations will not be possible depending on the level of FGM that the patient has as well. So if you examine and you realise that actually I'm not going to be able to do what it is I want to do, then communicating that to the patient as well and saying, you know, because of what's happened, we're not going to be able to do this type of things today, but then speak to her sort of about options around that. I do see women who have had FGM, which is illegal, by the way, guys, in the UK it's completely illegal, but who have had it when they were younger and in a different country. And the only time that we've seen them is sort of during childbirth or just before they're about to have a baby, and depending on the level of FGM, it can be very difficult, well, sometimes impossible to facilitate a normal delivery, a vaginal delivery, because of the level of FGM. We do like to, so when a woman books her pregnancy, so when she realises she's pregnant, she gets a midwife. One of the screening questions is about FGM. It's really important for us to know early on in the pregnancy whether the woman has been a victim of this. And that's in order to safeguard her, safeguard any of her female children, as well as also be able to plan her birth, or the birth of her child, so it's comfortable for her and the family.
Okay, that's amazing. Thank you so much for helping answer that. So yeah, I think you wanted to speak a bit more about smear tests.
Gosh, yeah. So smear tests. Oh my goodness. Yeah, smear tests. So, the NHS, we have a national cervical screening programme. So from the age of 25, every woman in the country will get a letter through her GP sent to her to invite her to come and have a smear test. And why are we doing that? Is because we know that it's probably one of the best screening programmes that we've got in the NHS for reducing death through cervical cancer. Cervical cancer is something that affects younger women, and if we can try and reduce those deaths as much as possible, then I think it can only be a good thing. However, black women, again, disproportionately do not show up for their smear tests. Why? And I think there's a lot of stigma associated around going for a smear test. So In terms of smear tests, I spoke about it before, but if you have never been sexually active, you do not have to have a smear test. However, even if you have only had one sexual partner throughout your whole life, you can still be at risk of getting HPV. So you should be going for a smear test. In terms of the smear test itself, it's usually carried out in your GP practice, and there are usually nurses who are trained to do it there actually. So my GP practice that I go to, there is a nurse who does it, and they're trained to do it. So most people are quite nervous about it, which is completely normal because it is a bit, it's a bit strange when you first go, but if it can save lives, then there's absolutely no reason to not get it done. You know, psych yourself up. It honestly lasts a whole I actually counted how long it lasted in my last smear test. I was in and out within 3 minutes, guys. 3 minutes. The nurse had introduced herself, said hello, I was on the couch, had the smear test gone, and the result came out the next couple of weeks. So I just can't recommend it more. And guys, it's once every 3 years. It's not like we're asking you to have this done every month. Once every 3 years, and at least you know you're okay. However, if you've had your smear test, it's come back normal, like within so before your next smear test, you've got 3 years, you start getting symptoms like bleeding after sex or bleeding in between your periods, which you are unsure as to why that's happening, then you do need to see your doctor, because those are some of the signs and symptoms that can be associated with cervical cancer, and it's really important for you to see your doctor so they can refer you to a gynecologist if need be.
Okay, thank you so much. Yeah, let's just talk a little bit about childbirth. And
oh gosh, yes, that's the big topic.
We hear so many things. Now I've come to an age where I'm hearing about all these hidden, like, not symptoms, that's the wrong word, but like people's hair falling out, people's bums tearing.
No,
like,
I mean, it is possible. So as an obstetrician, so the other half of my job is looking after pregnant women, so women during the whole of their pregnancy up to childbirth and a few weeks afterwards. So it is very possible for a woman to go her entire pregnancy without seeing a doctor and just be looked after by a midwife, and that's what we call low risk women. So they haven't got any medical problems, their baby's absolutely fine, they can just see their midwife, and then when it comes to have a baby, they can have their baby either at home or they can have their baby in a hospital, but the unit is only run by midwives and they never see a doctor. Unfortunately, where I work is very high risk, so I am more involved in the high risk deliveries and pregnancies and looking after women with lots of different medical problems and sometimes difficult deliveries. So I don't want to scare you guys, because the majority of women actually, believe it or not, have quite straightforward pregnancies and childbirth experiences, but you only ever hear about the ones who don't, right? That's how life works. But in the same hand, I only ever get involved in the deliveries that aren't straightforward, so that's when the doctor gets called. My job essentially is looking after the high risk women during their labour, and if they need help with the delivery, then that's when I might need to come in. There's lots of different things that we can do to help deliver the baby as a doctor. We use instruments to deliver babies when they are, you know, for various different reasons.
What's that?
So
did you say instruments?
Instruments, yeah, like forceps and things like that. God. Yeah, so that's kind of when we get involved.
Do you deliver yourself?
Yeah.
You actually deliver?
Yeah, I deliver the baby. Or for if the woman needs a cesarean section, then that's also when I get involved. But otherwise, then it's midwives do all the deliveries. So I see disproportionately a high amount of high risk though, guys, because of where I work, but there are units where women just come in, have their babies without any pain relief and go home, and sometimes the same day. So it's not all doom and gloom.
Okay, so we shouldn't be worried.
So everyone's pregnancy is different, and also even one pregnancy that a woman's had will be different to her second pregnancy, different to her third. So
True. Okay. Alright then, so we've done everything. Okay, I just want to say a huge thank you to Olga. This has been amazing. I've learnt so much. Like, imagine we've gone through so much. And yeah, I feel a lot more educated now.
It's been my pleasure, honestly.
Yeah, so is there like your social media?
Oh gosh, yeah, like,
guys, plug yourself.
Yeah. I'm not on the Twitter sphere, unfortunately.
Yeah,
You're
too busy, man. Time for that idle chit chat.
But I'm on the grams. I'm on Instagram. You can follow me at Dr_OEN, which are my initials. And yeah, I sometimes post bits. Well, yeah, I post bits about work as well as just general stuff. And if you have any more questions for me, actually, I don't mind answering them through the DM or anything.
Okay, thank you so much. Thank you guys for watching this video. I hope you've learnt so much, and I'm gonna try to come back with more informative videos that relate to our issues as women. And thank you so much for watching. And don't forget SARS, what's happening in Nigeria. Please don't lose the
momentum. We've got to keep it going.
Don't lose the momentum. It's so important. But thank you so much, guys,
Thank you
for watching.
me.
Yeah, thank you so much, Olga. And yeah, I'll see you guys in my next video, guys. Bye.